Hello, my name is Danny. I'm here to talk about how to use nitroglycerin tablets safely and what you need to know about this important medication. These tablets go under your tongue when you have chest pain, also known as angina. This type of pain happens when your heart isn't getting enough oxygen-rich blood. This medicine helps fix that fast, but only if it's used in the right way. Let's start with what the medicine actually does inside your body. This part is called pharmacodynamics, which just means how the drug works. Nitroglycerin works by relaxing the blood vessels in your body, especially the ones that feed your heart. When these vessels relax, more blood and oxygen can reach the heart. That helps stop the pain quickly. So instead of your heart struggling to get what it needs, the medicine makes it easier for your heart to do its job. That's why it's given during chest pain or sometimes even before activities that usually cause it, like climbing stairs or walking in the cold. Now, let's talk about pharmacokinetics, or how the medicine moves through your body. Because the tablet goes under your tongue, it doesn't need to go through your stomach like most pills. It dissolves right there and is absorbed directly into your bloodstream through the capillaries under your tongue. That's why it works so fast. It usually takes 1 to 3 minutes to feel the effect. The effect usually lasts about 30 to 60 minutes. After that, the liver helps break down the medicine and your body gets rid of it through your urine. Okay, so now how do you actually take it? First, and this is super important, you need to sit down or lie down before using it. A lot of people skip this part, but standing can make you dizzy or even cause you to pass out when the medicine kicks in. This is all due to it lowering your blood pressure. I once had a patient who took the nitro from standing, and he actually ended up falling and he hit his head and not only had a heart issue but also had a bleeding issue in his head. So very, very important to sit down first. So then after you sit down, place one tablet under your tongue, let it melt. Don't chew it, don't swallow it whole, just let it sit and dissolve on its own. If the chest pain hasn't gone away after 5 minutes, you can take another tablet. If you still feel pain 5 minutes later, you can take a third tablet, but the key part is you have to call 911 after you take the first tablet if the pain continues. Don't wait until you've taken all three. You could be having a heart attack, and the sooner you get help, the quicker we can bring blood and oxygen back to that tissue. Let's talk about side effects. Because every medicine has them, the most common ones are headache, dizziness, or lightheadedness, and a warm and flushed feeling, especially in the face or the chest. Again, this is all secondarily a result of your blood pressure just dropping and that vasoconstriction of the vessels. Some key takeaways from this slide. Do not use this medication. Do not use nitro if you're taking Viagra, Cialis, Levitra. If you have those medications in your system, those medications already drop your blood pressure. So taking nitro will cause a great sudden drop in blood pressure, which we do not need. That is not safe. And of course, do not take this medication if it is not prescribed to you. You and your doctor will have already had a discussion on why you should be on nitro, hopefully. So not all chest pain is the type of chest pain that you need nitro to assist with, so you don't want to be just giving nitro out to your cousin who is having an anxiety attack and therefore having chest pain. Not all chest pain is the same chest pain. Okay, so now let's talk about who should be careful with this medicine. It's not usually given to children unless it's under very extreme special circumstances, which hopefully the doctor, the parents, and the child will all have an understanding of. And for older adults, which honestly this medication is often given to, they tend to be more sensitive to blood pressure changes and blood pressure lowering effects. So again, sitting or lying down, even taking the pill, when taking the pill is important. They should also get up slowly afterwards to avoid falls. Alright, so with this medication, the storage matters. When you see the pill bottle is like this dark brownish bottle, small glass bottle. You want to keep it in a dark, kind of air-conditioned area, away from heat and light. So keep it in the original bottle it comes in. Light and heat can make it less effective. Also, with this medication, even if you haven't used it, you need to replace it every 6 months. They lose strength over time and may not work when you need them most. So to wrap things up, Nitro is a fast-acting medicine that can relieve chest pain and possibly even save your life, but it only works well if you know how and when to use it. Sit down, take it under your tongue, know what to expect, and call for help if the pain doesn't stop after the first dose. If you have any questions or concerns, always talk to your doctor or your pharmacist. They're there to help guide you through using this medication safely. And thanks for listening. I hope this helps you feel more confident about using your medication. Here are my references. Thank you.